Hi, I'm Dr. Sridhar Kalyanasunaram. I had recently been to India to attend the NNF or IAP Neocon in Thrissur, which was organized by Dr. Manoj and team. It was a great affair, very successful. It was nice to meet a lot of colleagues. And one of the topics we discussed was about how the neonatal care is organized in the medical care setup. So the reason I am sharing this video is just to share a few thoughts. The question is, should all medical college hospitals have a separate NICU team? And the reason this question comes up is because I realized that this is not the case already in most of them. So I have my previous lecture on neonatal intensive care in resource limited settings, and I'll share the link in this video as well. The focus of the government is on improving grassroots level care, mainly the level 1 and 2 care. So the special care neonatal care units have been established and they are growing, and the grassroots level care is cheaper to implement and it impacts more numbers. So that's the reason the focus is on that. However, there has already been a significant investment in level 3 care, at least in the district hospitals and the medical college hospitals. So there are equipment, there are staff who are trained in neonatology. However, the focus is not on neonatology in level 3 in most of these units. And even if the government proposes to bring up this interest in the later years, it's better we start looking at it more seriously, because that we will never reach a stage we want to reach, because these are the epic centers who are going to guide the current special neonatal care units and the other level 2 units. And if they are underperforming, we cannot expect the level 2 units to perform to their peak ability as well. So I came to know that in majority of these, the NICU is not run by a dedicated team. So the pediatricians, along with the postgraduate residents who rotate, run these units, and even among the senior residents, there may be people who rotate with neonatology. Not all of them have a continuous care. So the nursing staff is the main one that is continuous, and because the pediatric consultants are running it, the guidelines aren't updated as regularly. Their confidence in using the modern equipment, even if they are available, is not up to speed, and so the progress that we see in private care doesn't happen in these setups as well. So majority don't want to focus only on neonatology, as pediatric outpatient is important to sustain their practice and income, and this is very understandable because neonatology is not going to bring you patients in big numbers. However, the objective should be to improve the care without their feeling threatened about their future, and that's where the leadership should play a role. So the disadvantages of not having a centralized NICU team is that there is a reduced impetus to strengthen the skills, so they may not do their fellowships and improve their knowledge, their ability to save smaller and smaller babies, which any unit has a growth curve, will not achieve here. Their ability to renew guidelines or to disseminate the information within their team will be limited as well, because they have a big pediatric practice. Their commitment to neonatology is maybe 1 week in a month, and then if they tide over that week, they have other pressing things to attend to. There is no continuity of care because they hand over to the next team. There are these are the units that support the smaller level 2 units, as I said earlier, and a good outcome here would motivate them to do better, and they can also guide the smaller units to do better. The equipment that is already there would be put to better use, and they could have a bigger voice with the management in terms of securing more staff, securing more support systems, and so on. The request that I would make for the Indian Academy of Pediatrics, as well as the National Neonatology Forum and the leadership of these units, is to review their system in a futuristic point of view. So there are problems to surmount. So it's not easy to say that you don't practice pediatrics, but you have to find a way where you give them the opportunity to develop themselves as neonatologists. Their focus is mainly on the neonatal unit, but work in such a way that neither the pediatricians lose access to the newborns for follow-up, because only a small percentage of the babies need intensive care. Most of them are well newborns, and these babies could still be managed by the pediatricians under the supervision of the neonatologist. So it doesn't mean the pediatricians would lose the newborns, and also the person who is choosing to be a neonatologist could continue to do neonatology in the private sector as well, if their option is available in that government sector hospital. So it will be a win-win situation if you put your heads together and try to work a system. And the reason I'm highlighting this is just to see if we can make any difference to develop this part of neonatal intensive care in India. Please share this information and encourage your teams to discuss it as well. Thank you.